So chemotherapy-induced nausea and vomiting. So the pathophysiology of this condition is that chemotherapy will irritate the mucosal lining of the GI tract. The vagus nerve and the enteric nerve will relay this information to serotonin receptors, and these serotonin receptors will act on the chemotherapy trigger zone, which is the CTZ, which then causes the sensation of nausea and vomiting. So a medication we could use for this condition is the Granisetron. So the way this medication works is it'll block serotonin receptors, so it doesn't act on the chemotherapy trigger zone, which then causes no sensation of nausea and vomiting as the signal is not being relayed into the ZTZ. We could see with the red arrow here is that having an understanding of the pathophysiology of the condition can give us an understanding of how a medication can work to alleviate this condition that's happening. So the top 3 assessment that I will look for with a patient with this disease is the Mallory-Weiss tear. So this one, it occurs with forceful vomiting. What happens is the mucosal lining basically will tear or erode, and we can see bleeding with the emesis. With that, it could lead to inflammation and pain, which is the concept we see here. And for aspiration, so with vomiting, there is a risk for the patient to aspirate. So when the epiglottis fails to close during swallowing or vomiting, stomach contents can go into the airway and cause an infection, which can also lead to pneumonia. So this is a risk that I will assess for. And this aspiration also relates to the concept of inflammation and pain. So it could be like pain from discomfort in the respiratory area. And we have the metabolic alkalosis and acidosis. So metabolic alkalosis will occur with vomiting as the stomach content is acidic, so we lose that H plus when we vomit. So this gives rise to hypokalemia, hypochloremia, and hypovolemia, just because it'll have decreased fluid and food intake with that, obviously due to vomiting. So this relates to the concept of fluid and electrolytes. So there will be an imbalance in that concept. So overall, all 3 assessment relates to the concept of nutrition. So because of these 3 things, my top 3 assessments, because of that, it affects nutrition in such a way that you'll have decreased foods and fluid intake. And also, we could see the black arrow here. So if medication is effective, we'll see a decreased sensation of nausea and vomiting. So we'll have greater nutritional intake here, a decreased inflammation and pain, and better fluid and electrolyte balance. Next thing, before administering this drug, I will assess for the presence of nausea and vomiting. So this allows me to gather the baseline data and lets me know if it's still indicated for this patient to be taking this medication. So we could see with the orange arrow here that assessing this nausea and vomiting, we should be thinking about and relating to the pathophysiology and thinking really why are they feeling this way, and which also relates back into the medication and how it really helps the patient decrease that sensation of nausea and vomiting. Another thing that I will assess for is like drug interactions, just because the Granisetron, this medication can actually prolong QT intervals as an adverse effect. So I want to make sure that this patient is not taking another medication that increases the QT interval, because that could be very bad. So making sure there's no drug interaction there. And after I administer this medication, I will assess for the effectiveness of drug. So this is the decrease in sensation of nausea and vomiting. And we could see this with greater tolerance of fluids and food intake. So we can see with the purple arrow here, assessment findings that indicate that the drug is working effectively is decreased sensation of nausea and vomiting, improved appetite in comparison to baseline. And another thing that I will assess for after administering is hypersensitivity and allergic reactions as per every drug. So assessment findings that basically indicate to me that the drug is not working is prolonged vomiting and no improvements with appetite. So with prolonged vomiting, we could see the metabolic acidosis, and with no improvement with appetite and with the prolonged vomiting, this basically can exacerbate the fluid and electrolyte imbalance. It can cause further inflammation and pain, and obviously there's no tolerance for fluid and food intake.